Hundreds of Virginians die from drug overdoses each year, and behind every statistic is a life cut short and families left searching for answers.
ABC 13's Rachel Branding investigates why the need for addiction treatment is outpacing available care.
The eternal misery that I go through on a daily basis never seems to ever want to let up. And I've come to accept it and learn how to thrive in it, baby.
It started with a tooth abscess and a broken ankle. 2 prescriptions for opioids spiraled into a nightmare for Alex Elliott.
Where are the Percocets? Give them to me now.
Addiction ran on both sides of our family, and he had a disease, and he fought every day. He fought very hard, and he wanted to get clean, he wanted to get sober, but unfortunately the system failed him.
On March 2nd, Alex died from a fentanyl overdose. He was just 25. The fentanyl was laced with medetomidine and dexmedetomidine. One is an animal tranquilizer and the other is an ICU sedative. Both mimic the effects of fentanyl. Drug dealers use them because they're cheaper and stretch the supply. The effects are unpredictable and last longer than fentanyl alone.
Alex deserved better.
To all those that think it's impossible, recovery is an option, and it is possible. You just have to want it.
We did everything possible to try to help him.
The Daltons sent Alex to a treatment center in Southwest Virginia, but they pulled him out early.
There was a guy that overdosed there, and Alex had to Narcan him to bring him back. He would break up numerous fights.
They sought help locally. The Daltons say they were told there were no inpatient beds available for at least a week. They say his counselor also told them his drug use didn't qualify as a relapse.
His exact words was, "If I'm not high, I want to die."
And it's in that documentation that his counselor knew all that.
With an inpatient program off of the table, Alex was put into a virtual outpatient treatment program.
He lasted 2 weeks into the virtual outpatient program.
2 weeks, and we found him dead.
Do you all feel like if he was able to get a bed somewhere, go inpatient somewhere, he would still be here today?
Yes.
Yes, absolutely.
Most definitely.
Because he would still be in the inpatient program right now. I mean, so he would be somewhere.
Alex's story is heartbreaking.
I really do care and want to change my ways.
But not unique. The Central Virginia Health District includes Campbell, Bedford, Amherst, and Appomattox counties, as well as the city of Lynchburg. Health officials say 342 people died from overdoses between 2020 and 2025.
The opiates and the methamphetamine are the 2 larger problems.
Fatal overdoses have declined, partly due to increased Narcan access, according to VDH. But overdoses as a whole remain consistently high. One driving factor, VDH says there simply aren't enough inpatient beds.
Do you all know of a high demand for treatment centers like this in the area?
So the research that I've seen says that the demand has outpaced the capacity.
There's no one answer as to why addiction programs don't match demand in our area. VDH says it's everything from stigma surrounding addiction to funding and provider shortages. They also say there are treatment gaps for rural areas, forcing patients to travel to our area for care.
The beds are a hot commodity pretty much.
Centra's inpatient program, Pathways, has 20 beds.
We've seen that it is pervasive, and there is no population that is insulated and without the risk of being affected by these illnesses.
They also offer outpatient and virtual programs due to an ever-growing wait list.
What would it take for providers in the area to be able to expand and kind of meet the demand?
So there are several challenges. One is funding. We don't have a lot of funding from the federal government and state, so there's a need for more funding, period. Also, there's a need for more providers. We need more psychiatrists. We need more therapists.
They say more facilities are also needed. Nonprofit Roads to Recovery provides both residential and center-based treatment programs. They're opening a detox center on 5th Street in downtown Lynchburg with 8 inpatient beds.
I think one of the biggest gaps in the community right now is a withdrawal management program. We're trying to bridge that gap right there.
The inpatient beds give patients a place to detox from drugs. The focused, individualized setting removes them from the environment that triggers them. Having this kind of space available is vital because every second matters.
That's a critical time when somebody knows they need help, they know they need to change, and to reach out for it and be denied and walk back out the door. It's a life or death situation.
Get the help that you and everyone around you deserve.
While Alex lost his battle, his family hopes his story will help save someone else.
If you ever need someone to talk to, I'm here.
It's wiping out an entire generation if people don't start doing something about it now.
This is an epidemic, and it's going to get worse. It's not going to get better. It's going to get worse until something changes.
If you or your loved one is suffering from an addiction, we have a tool on our website where you can locate services. Head to WSET.com and search addiction. There you'll find a link where you can find providers near you and reach out for help. Back to you.